Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Gall bladder and the bile duct. Gallbladder and the bile duct imaging. So first is, what is the investigation of choice? It is a USG. Then how it appears? It appears black, and this is due to the bile fluid. There is also the echogenic calculus and echogenic calculus casting. So there's posterior acoustic shadow is also seen. Posterior acoustic shadow. It may be seen, and it is due to the gallbladder calculi. Next is, there is also the triradiate sign. So triradiate sign is also called as a Mercedes-Benz sign. So if it is biradiate, it can also give a seagull appearance. So it gives a seagull sign. So first let's look at acute cholecystitis. So IOC is the investigation choice, the USG, and the gold standard being the HIDA scan. It is for the acute cholecystitis. The acute right hypochondriatic pain is along with vomiting. Acute right hypochondriac pain is seen along with the vomiting. This is seen along with vomiting. Then there is also the Murphy sign. The Murphy sign is present. There is a thickened gallbladder wall by more than 3 mm. The HIDA scan, it picks up both the calculus and also the acalculous cholecystitis. Next, we look at the chronic cholecystitis. This includes a contracted gallbladder. So contracted gallbladder is something which is seen. It has thick walls and the echo shadow is seen. It is a wet sign in chronic cholecystitis. There is a wet sign. Then moving on to the bile duct. So what's happening in the bile duct? So bile duct, there is a choledocholithiasis. There is a beaded appearance, that is PSC. The onion peel appearance. The onion peel appearance is seen in case of fibrosis in neonate with the obstructive jaundice. There is also the obstructive jaundice. It is triangular cord sign is seen. The triangular cord sign is seen. It is in case of the biliary atresia, and it is ruled out by the HIDA. Now double barrel sign is seen in case of the CBD. So double barrel is seen in case of the CBD, dilation or the obstructive jaundice. To learn and grow daily like this, please do subscribe.